What is glaucoma? Glaucoma is a group of diseases that have a lot in common. In this disease, in a very slow and chronic way, the pressure in the eye is higher than what the nerve can tolerate. And what is a normal pressure is very person and even eye dependent. So let's talk about a specific person whose pressure in the eye is high. What will happen is that along the course of many years, sometimes even decades, the nerve will suffer from the high pressure, and very slowly that person will lose vision, usually side vision. That's the kind of vision that the person cannot feel that he's losing, he or she, and sometimes we need a visual field to document and to even learn whether the peripheral or side vision is normal or perhaps damaged. People with glaucoma usually don't know they have the disease because they don't feel the pressure, they don't experience pain, and their vision from their point of view is perfect. They don't notice that in the side of the vision something is going wrong and the field of their vision is shrinking very slowly. People who are diagnosed with glaucoma, and you can fairly ask, if you can't feel it, how will I ever know I have it? And the answer is, when you go to your eye doctor, the eye doctor will look for certain conditions, and one of them he will ascertain whether you have glaucoma or not. So every time you come to an ophthalmologist, he may check the cornea, the retina, and glaucoma, for instance, as well as many other conditions and problems that a very small fraction of the population may have. Once glaucoma is diagnosed, it's a chronic, lifelong disease. It will not go away. It will stay there till your last day. But what's far more important than that, we want your vision to stay there until your last day. We want you to continue seeing as good as you see today for the rest of your life. And for that, the patient has to do two things. One is to take the treatment that was prescribed, and the second thing is to stay under the care of an ophthalmologist. That's simple, but needs to be said. If you see a doctor and he tells you have glaucoma and you disappear, you never come back, you don't do the tests, you don't take the drops, the disease continues in what we call the natural course, the untreated course of the disease, and that's usually, sometimes always, downhill. If you take treatment, we have a chance to turn a downhill into a plane. Treatment is usually drops that need to be taken every day, sometimes one bottle, sometimes several bottles, sometimes once a day, sometimes twice or even 3 times a day. If drops are not enough, we have the option of laser, we have option of tablets, and we have an option of surgery. And it all depends how bad the glaucoma is in that specific eye and how fast it's progressing. In general, if the pressure is higher, if the disease is progressing, if the nerve seems to be very damaged, or if the visual field shows that it's getting worse from one field to the next, we would want to be more aggressive, and these are the kind of patients that eventually may need surgery. Having said that, you need to remember and to stay optimistic because it's true. That's the fact of life. The great majority of glaucoma patients will continue living a very normal life even though they have glaucoma. They will continue seeing, they will continue driving, they can do anything, even extreme sports, go diving, fly in planes, no problem. But they need to be under the care of an ophthalmologist and to do whatever that ophthalmologist says, which is usually a combination of taking your drops, doing the visual fields, and coming back for future exams. Having said that, I wish you the best of health. הערות?